This episode of GT the Podcast is supported by Alcon. This is an editorially independent podcast supported with advertising by Allergan Glaucoma Drops.
This is Ike Ahmed.
And I'm Arsham Shaybani.
And we want to welcome you to GT the Podcast.
We're bringing this to you together with BMC and Glaucoma Today,
to offer audible insights into current topics in glaucoma care.
Presented by the authors of our latest, most read GT articles.
Check it out.
Welcome to GT the Podcast. In this episode, Dr. Nicola Ragusa reads his article, Is It Time to Rethink the Slit Lamp? From the July-August issue of Glaucoma Today. This article reviews a practice-based survey that considers patient comfort during eye exams and challenges for the redevelopment of certain ophthalmic equipment to promote greater accessibility. More on this from Dr. Ragusa.
The COVID-19 crisis has emphasized the importance of the ability to adapt to changing times by working smarter and more safely. In glaucoma specifically, we have seen adjustments made to IOP exams, with some offices implementing drive-through pressure checks. We saw a substantial increase in telehealth visits and began to connect routinely with patients in a way we likely never dreamed. Even mainstay methods such as visual field tests shifted dramatically towards safer and easier to clean modalities, for example, virtual reality headsets, and away from the classic white-to-white automated perimetry conducted in bowls. The year 2020 taught us that cultural awareness goes beyond what we consider the norm in years past. As society becomes more culturally aware, it may be time to rethink eye exams. We conducted an informal survey at my office in the Bronx, New York, in which we asked approximately 300 patients about a range of elements of their eye exam experience. As expected, most patients commented on social distancing in the office, and some did not appreciate the wait times. These mutable elements are more of a function of staffing and scheduling, constant disruptors in the office. We were surprised, however, by the response regarding issues with slit lamp exams. Patients cited challenges with head positioning, mask wearing, and chest compression. The complaints were significant enough to negatively affect about 10% of the patients surveyed. For most, the COVID-19 pandemic, masks have been mandatory in the New York City area and businesses. Although some restrictions were recently lifted, indoor mask wear is still recommended for vaccinated individuals and required for unvaccinated individuals. Masks with pronounced protuberances may interfere with proper positioning of the gold mantanometer and may result in faulty readings. These masks include cupped N95 masks, duck-billed KN95 masks, silicone-supported fabric masks, and standard surgical masks with poorly positioned metal nasal molds. The challenges occur mainly owing to the greater dimensions of these masks compared with standard surgical masks, and because of a pre-shaped ridge nose area that may press against the gold mantanometer. Recommendations for curtailing these issues include the following. Adjust the patient's mask to the side while covering their nose and mouth if possible. Tilt the patient's head slightly away from the tonometer arm to clear the feeder arm while asking the patient to maintain a forward gaze. Compress the patient's mask with your hand or a cotton-tipped applicator to prevent any contact during measurement. And, if none of the adjustment is successful, consider using a handheld tonometer such as the iCare IC100 or TonoPen. Despite the use of these tactics, it may be necessary for patients to remove their masks during IOP measurement. This places the examiner and patient at risk of airborne pathogen exposure, with mask wearing likely becoming a long-term scenario as new COVID strains emerge. Device manufacturers may benefit from tonopen and tonometer redesigns that eliminate the safety burden. A design similar to that of the AT870 applanation tonometer, which does not come in contact with the lower portion of the patient's face, is worth re-exploring. From 1999 to 2018, the age-adjusted prevalence of obesity increased from 30.5% to 42.4%, and the prevalence of severe obesity increased from 4.7% to 9.2%. In an ophthalmic practice, obesity affects how patients are examined with the current slit lamp designs. Obese patients, women in particular, are most likely to be physically restricted from properly fitting into the slit lamp headrest, mainly because of the increased upper chest circumference. In this scenario, the focus of the anterior segment exam is affected. Goldmann applanation tonometry is not possible in patients experiencing significant chest pressure and discomfort. Some newer fundus cameras, such as the Aiden, have an offset headrest design to minimize discomfort for obese and, in particular, female patients. Another element of the exam that patients in my office rated negatively was the physical positioning of their head in the slit lamp. This issue affected individuals who wear head coverings or have hairstyles that alter the height and width of their head in the slit lamp. These patients were not able to fit into this typical closed-loop slit lamp head holder. An open and wider headrest design would be more culturally appropriate and would make the exam more comfortable for these patients. The Haag-Streit 900 has long been the gold standard in the slit lamp design. Introduced in 1958, this device has become the most copied and respected style of slit lamp on the eye care market. Although this device provides excellent optics and comfort for the eye care provider, the patient's experience may require more attention and innovation. The past several decades have brought great cultural and social change, and this evolution has affected the practice of medicine and attitude towards patients' comfort. In addition to taking physicians' preference into account, it may be time for all device manufacturers to consider how patients feel about their exam. In our practice survey, patients who could not fit into the slit lamp headrest reported feeling embarrassed, uncomfortable, ashamed, body conscious, and out of breath from chest compressions, and lastly, upset. As we become more culturally sensitive as a society, we must recognize that the design of our ophthalmic equipment may not be accessible to all patients and may therefore warrant rethinking.
Thank you for tuning into this episode of GT the Podcast. If you have any feedback or topic suggestions, find us on Instagram, LinkedIn, Facebook, or Twitter. And stay tuned for more hot topics in glaucoma care on GT the Podcast.